It's happening all over the country. It's called leptospirosis, and maybe more often than ever before, this is a concern if you have a dog and might be a concern for your family. To learn more about it, we're visiting Blum Animal Hospital with Dr. Natalie Marks.
Leptospirosis is a re-emerging disease across the country. So it's a bacteria that rodents carry around and other wildlife, and they urinate it out into standing water sources, and our dogs are exposed either through contaminated drinking water or from stepping in it and licking their feet.
Zoe is traditionally a very bouncy and happy girl, and she started being more tired than usual, and she was vomiting, and so we brought her in because she just wasn't herself, and got the diagnosis back that she had leptospirosis.
Some dogs have a chronic carrier phase, so they have the bacteria in their body and they're acting fine, but they're urinating excessively, and this is just as worrisome because it does put your family at risk. So if your dog has lepto and is carrying it in their body, urinates in your house, and you've got a toddler crawling around and putting their hands into everything and putting their hands in their mouth with that urine, there is a chance of transmission. There is a test for lepto. It involves a blood and urine sample that we can do tableside, which means we'll know in 30 minutes, or send out to a lab. When we catch this disease, we can treat it with antibiotics, but the problem is sometimes we catch it too late, and a lot of people still aren't aware about it.
We were really lucky to catch it early on, so there was not damage to her liver that was long-lasting, and it hadn't spread to her kidneys. We got her started on a medication treatment, and now she's back to being her bouncy, lovely self.
So clearly, leptospirosis is not something you want your dog to get or your family to be exposed to. The good news is that it can be avoided with vaccination.